Welcome to the Canadian Liver Foundation's 2022 LIVERight Health Forum Ask the Experts series. We are pleased to welcome Dr. Richard Schreiber to speak on the topic, Children and Liver Disease, What All Parents Should Know. Dr. Schreiber is the Senior Liver Specialist and Director of the Pediatric Liver Transplant Program at the BC Children's Hospital. Dr. Schreiber's outstanding work helps to save the lives of many children who are born with rare, serious liver disease. Ultimately, he and his team strive towards the day when all pediatric liver diseases are cured. Please join me in welcoming Dr. Richard Schreiber and our host, Dr. Valeria Zaborska.
Hi, everyone, and welcome to the session, Children and Liver Disease, What All Parents Should Know, with our lovely Dr. Richard Schreiber. So Dr. Schreiber, I'm going to jump right into the questions. So these are questions sent in by the audience about children with liver disease. And the first question is, at what age is a child's liver fully developed?
So first of all, before we get into questions, I'd like to thank Monica and you and the whole organization in the Liver Foundation for inviting me to speak. It's not often that organizers remember that children do get liver disease, and they often don't have sessions about pediatric liver disease. So kudos to all the people who organized this event on liver health to remember that they remember to include pediatric subjects in this session. So thanks for that. Now, Valerie, you're asking me about what age is a child liver fully developed. Well, actually, the liver begins to develop during pregnancy, quite early in pregnancy, around the 4th week of pregnancy. The liver begins to develop. The liver draining system, the biliary system, which is the bile duct and the gallbladder, they also begin to develop around the 8th week. And then over the next 4 or so weeks, there's a lot of remodeling that happens in the fetus so that the ducts connect properly and the systems work and the blood supply starts developing, so that actually by the 12th week of pregnancy, the liver actually in the fetus now looks like a liver, like you would imagine it would look like in an adult. And then from the 12th week in pregnancy onward to delivery, the liver is just growing, much like the fetus is growing until it becomes a newborn size. And then even after birth, the liver is not quite like an adult. The liver is still going to be growing. A liver size, for example, in a newborn is about 2 or 3 centimeters in length. And in an adult, it's about 8 centimeters in length. So there's a lot of growth that happens with that liver over time. And it's really not until a kid is around the age of 12 that the liver is the same size and fully developed like an adult liver. So it starts really early in pregnancy, and it takes a long time, many years for the liver to develop into full size. That doesn't mean that the liver doesn't work. The liver works fully normally right after birth. It's just that it grows with the size of the baby until it reaches full adult size.
Gotcha. This ties in a little bit to the next question, which is, why do babies get liver disease? Is it genetic or environmental? And it sounds like what you described earlier, there's a very long process of development and remodeling. So I suspect that has a little bit to do with it.
That's quite true. And actually, there are a whole variety of liver diseases that occur in babies and children and adolescents. Of course, many of the conditions that we see are inherited or genetic, but each one of them is very rare. Genetic liver diseases occurs in like 1 in 100,000 births. So each genetic liver disease that we see in a baby is rare. Sometimes we don't see any in many, many years because they're so rare. On the other hand, when you group all of those genetic diseases together, they actually make up about, say, 40% of all kinds of liver diseases that we see in children. So inherited or genetic diseases all together make up about 40%, but each one in itself is very rare. So that's true. Now, some conditions that we see in babies or children, you also see in adults, like immune liver disease, like autoimmune hepatitis or sclerosing cholangitis. Those conditions also occur in children. And of course, like adults, babies and children do have risk for developing viral hepatitis, hepatitis A, hepatitis B, and hepatitis C, although how they get those diseases is different than in adults. And unfortunately, albeit quite rarely, there are kids who have liver cancer, but that's pretty rare. Now, recently, we're seeing more and more kids, particularly adolescents, and most often because of the current COVID pandemic, we're seeing lots of kids developing fatty liver disease. And that's because kids are not eating necessarily healthy foods, a lot of like juices and high calorie, what I'd call, quote, American junk food. And kids, particularly during the COVID pandemic, have become quite sedentary. They haven't been doing much activity. There haven't been many, for example, group sport activities for them, or often opportunities to get out. And so many of them are sitting around playing on their computers and not really doing much. So we're starting to see lots of fatty liver disease in kids, which is a new kind of picture for us pediatric liver specialists. Even before COVID, we started seeing obese children with fatty liver disease. And this is a growing problem for us in pediatric liver management, is that we're seeing kids with fatty liver disease. And thankfully, we don't see alcoholic liver disease in children, and sometimes we get in adolescents who may be binge drinking, but that's unusual. So it's not a common problem for us. Alcoholic liver disease is not a condition that we see in children, although of course you do see that in adults. Now, the last thing I want to say is a leading cause of liver disease in babies, which accounts for up to 45% of all liver disease in baby, is a condition we call biliary atresia. And I know we're going to talk about it a little later. We actually don't know the cause of this disease, but it is the most important pediatric liver disease. And why is that? Well, it's the most common reason for liver-related illness in children and liver-related death in children. It's also the leading cause of end-stage liver disease or cirrhosis in children. So in adults, where you see cirrhosis usually from hep C or now alcoholic liver disease or fatty liver disease, in children, the leading cause of cirrhosis is because of this condition called biliary atresia, which is not genetic, not inherited. We actually don't know the cause of the disease. And also this condition is the leading indication for liver transplantation in children. So 60% of all kids who have a liver transplant will have had it because of this disease called biliary atresia. And that's a uniquely pediatric liver disease. Adult patients do not present with biliary atresia. You either have it, right after birth, or you don't have it when you don't develop this condition at age 30. So it's not an adult liver disease, it's a unique pediatric liver disease that has a lot of morbidity and associated mortality.
Thank you. And it definitely sounds like similar to adults, there are very many causes. And so following that, what are the common symptoms and signs in kids that they have liver disease? And is jaundice always an indicator, or can it be not related to liver disease? And also a question for me personally is, you were mentioning that you can get cirrhosis in children. Are the symptoms of cirrhosis in children similar to those in adults? So 2 questions.
So that's good. So first of all, what are the common signs and symptoms of liver disease in kids? Well, many of them are similar to what you see in adults. So jaundice, yellowing of the eyes, yellowing of the skin, that's pretty common presenting symptom or sign of liver disease in children. The conundrum, the problem, is that in the newborn period, 65 to 70% of newborns have jaundice in the first week of life. That goes away. We call that physiologic jaundice. And sometimes those kids need the lights, the phototherapy for management, but it goes away. It's a benign condition. That's not a liver problem. So in the newborn period, most kids who have jaundice have it not because of a liver problem per se, not because of liver disease, and it goes away. But there are let's say the yellow needle in the yellow haystack. There's 1 in 2,500 births, kids who have jaundice that'll have a liver disease. So yes, jaundice is a sign of liver disease, But the caveat is that in the newborn period, I don't want every parent out there to worry that when their newborn is jaundice, oh, they have liver disease. The vast majority of, in the first weeks of life, the jaundice is not related to liver disease. It's only if the jaundice persists, keeps going without clearing, because it should go away. If it persists and your infant, a newborn, is jaundiced after 2 weeks of age, a red flag goes up. That's when you got to start thinking that the jaundice is a symptom of liver disease. So that's the caveat difference in a baby compared to adults. Also, the thing to think about in kids, we do see other indicators, like they can get fatigued or tired or irritable. Like you can have those symptoms associated with it. They can have nausea or tummy pain. You can have those symptoms with it. But uniquely in children, unlike adults, is we are very concerned about kids' growth and development. And if a child isn't thriving properly, isn't growing properly, that's always a red flag. And sometimes growth disturbance can be a symptom of liver disease. So when a kid is not growing, in the possibilities, one needs to think about there being liver disease. Similarly, development, a kid's development is also very important. And sometimes kids have muscle weakness or hypotonia, where they're just not developing properly. That also could be a symptom of a liver disease. And so those are different symptoms than what you'd see in an adult patient, because remember, the central hallmark of pediatrics is kids are growing and developing. And if they have a liver disease, then of course it could impact on how they're growing and developing. And so we have to think about that in pediatric patients. The last thing I want to mention is that in the newborn period, kids are supposed to be given vitamin K right after birth, because that prevents them having bleeding problems. They happen to be deficient on K very early in life. And so all babies get vitamin K at birth. It's standard of care. But if there's a liver disease going on at birth or soon after birth, bleeding could be another early feature or early symptom of liver disease in that particular newborn period. So now, the last thing I want to mention is that I said that in the newborn period, jaundice is a very common thing. Many kids have jaundice not because of a liver disease. So another important sign that we look for in pediatrics, which adults don't always pay attention to, is the stool color. When a kid has a liver disease like biliary atresia or other forms of specific liver diseases, the bile flow isn't good. And it's the bile, the flowing of the fluid from the liver to the intestine, the excretion through the liver to the intestine, that fluid coming into the intestine causes your stools to become colored or brown. And if there's a problem with the liver, the flow doesn't go properly, it's sort of like the tap turns off and there's no flow. And so an associated symptom of liver disease, aside from jaundice, particularly in newborns, is the fact that the stools lose their color and they become chalk white. So if you have a baby who's jaundiced with chalk white stools, then you're sure that there's a liver problem going on. So that's another kind of subtle symptom that we look for in the newborn period, the color of the stools, and we'll get back to that later.
Great that those cards
Yes.
get given out at children's hospitals for mothers and newborns.
Yeah, I want to just say, you asked me about tests to assess the liver. So basically the tests are the same and very similar to what we do in adults. So, we do blood counts. We do something called liver function tests, which look at the enzymes from the liver, AST, ALT, GGT, alkaline phosphatase. And that kind of gives you a sense of what the pattern of the injury may be, whether you have a hepatitis or you have a bile duct problem, or what we call cholestasis. And because we see sometimes, again, it's rare, metabolic disease, we often test for metabolic disease in the newborn period. And particularly that involves also doing a urine test. So that becomes part of our initial first step laboratory testing for liver disease in kids.
Well, thank you. Very thorough answer. And you were mentioning biliary atresia as the most common cause of liver disease. What is the survival rate like? And can children live normal lives if they are diagnosed with biliary atresia?
So biliary atresia is a condition that's not inherited. It's not genetic. We actually don't know the cause of it. But as I say, it's one of the leading causes of chronic liver disease in infancy, so in the newborn period. And we've been doing studies of this condition in Canada. We've set up a national registry where every single baby born with biliary atresia is recorded and followed, so we can try to develop best standards of care. This is a research program called the Canadian Biliary Atresia Registry that has been established in British Columbia as the lead center, and it's now right across the country, and we're collecting data on every baby. So I'm saying all this because in Canada, we know that the incident, the rate of biliary atresia is 1 in 19,000 births. So that's not a common situation, but that's the number that we see. Now, it happens to be that biliary atresia is a little more common in the Asian population. So here in BC, our rates are a little more common, and they're running about 1 in 14,000 live births. There are about 45,000 births in British Columbia, so we see anywhere from 3 to 5 new cases in a given year. So that's how common that condition is, 3 to 5 new cases in a year. So now this disease needs to be diagnosed early. And if it is diagnosed early and managed early, then the survival of kids with their own liver could be very good. They can live for years with their own liver. In fact, we know that if you have your operation to correct this problem before 30 days of life, you have a 50% chance of living the next 10 years with your own liver. If, on the other hand, things don't work out so well, the second step of management is a liver transplant. And again, those kids do very well. Their survival rates can be upwards of 90%. So in answer to your question, do kids have a normal life with biliary atresia? Well, they have to see doctors and get blood tests like any person with chronic liver disease, but their lives can be completely normal. They can do everything. They grow appropriately well, just like they would for a normal child. They can participate in all activities. They go to school. They do all things, but they do have to be monitored and managed well because they are at risk for complications. So the answer to your question is yes, you can have a normal life even with biliary atresia.
Great, thank you. And you mentioned liver transplantation. Can you tell us how pediatric liver transplantation differs from the adult, and whether you can get a live liver donor similar to what they're doing with adults now?
Yeah, so, well, in Canada, we only do a total of about 40 pediatric liver transplants a year. And because of that, we as pediatric specialists decided to centralize transplant in Canada. There were 4 centers in Canada. There are now only 3 pediatric liver transplant centers. One is in Montreal, one is in Toronto, and one is in Edmonton. And it is those 3 centers that handle all the pediatric liver transplants in Canada. So this means that a child in BC at the moment needs to go elsewhere to get their liver transplant. Now, personally, I think that's not right. British Columbia is the 3rd largest province in Canada. We have a larger population than in Alberta, for example. And we have been trying for 20 years to develop a local BC children's transplant program, which would be coordinated with the adult transplant program. We have a total pediatric and adult transplant program in the province of British Columbia. I'm happy to say that we just completed a business case submission to the Ministry of Health through the PHSA, which is the Provincial Health Services Authority. They approve it. PHSA has approved the plan. BC Children's has approved the plan. And I thought I'd be able to make an announcement today, but I can't yet because I haven't yet received approval for this plan by the Ministry of Health. That said, we're hoping to be able to do local transplants here in British Columbia without having to send people off. From a family-centered care point of view, it is really difficult for a family to uproot themselves from their home and all their local contacts and families to go somewhere else to go through what I would consider one of the most difficult times for their kids to have a liver transplant. The outcomes of liver transplant, though, when we do send kids off anywhere, wherever they're done in Canada or elsewhere, are very good. The survival rates long-term are, close to 90%. And the really unique thing about liver transplant is once you get through the first year, because there's risks for rejection and infection and complications from the surgery. But once you get through that first year, you then have a lifetime survival. You don't tend to lose a liver graft. And unlike kidney transplant or heart transplant, you don't have to go back and retransplant a liver. In kidney transplant, for example, after 10 or 15 years, the organ has to be retransplanted. It just doesn't last long. The liver lasts forever. And it's really interesting. In pediatrics, we can take a piece of a 60-year-old liver from an adult, transplant that into a 2-month-old baby. It's sort of like you put it in and it fits. And then that liver will live another 100 years. And the liver grows with that kid. So it's amazing. The liver is an amazing organ. It's able to adapt and survive. And, age, the liver can live forever. As I say, you can take a liver from a 6-year-old, put in a baby, and then lives another 100 years. So it's quite an incredible organ. So yes, we do living-related liver transplants. We do that specifically in kids because it's hard to find deceased donor sized matched livers. And so we do this so that kids don't die on a waiting list. This is a unique thing for Canada. The US doesn't do this as well because of insurance complications. But here in Canada, it's pretty standard. And I would say 60% of all pediatric liver transplants are living related or even non-related living liver transplants, up to 60%. And we know, because we've been doing this since 1987, that the long-term survival for a living related or a deceased donor are exactly the same. They do as well. So we're blessed in Canada that we have the capacity to go ahead and do living related liver transplants. And I'm always amazed of how well the liver does regardless of the age of that donor. It's quite incredible.
Well, I really hope the program works out so that we can continue doing that kind of amazing work in BC as well.
Well, thank you. I put a pitch in. I hope, I've actually been working on this for the greater part of my stay here in British Columbia. It's been a long haul to bring the people to the table. But it's all the stars have been aligned now. The business plan went in, and I'm eagerly awaiting a government green light to go ahead and initiate this program. And in fact, the program is not just for transplant, it's to manage all kids in the province with very complex liver disease, be it genetics, like the kind of diseases I talked about, genetic diseases, vascular diseases, cancers. Kids have pretty complicated stuff. And so it allows us to develop a really high-level professional expert team approach, not just with doctors, but with nurses and social work and psychologists and surgeons and all the ancillary care, allied health care personnel you need to make sure that a child and his family have the best outcome they can have. So that's the whole purpose of the program. It's actually called a complex hepatobiliary program for children in British Columbia.
Fingers crossed. And kind of playing off this idea of teamwork, the next question is, what can parents do to keep their kids' livers safe?
Well, that's also a very important question. As I alluded to earlier, we're starting, unfortunately, to see kids with fatty liver disease. We didn't have that 20 years ago. So there's been definitely a change in what's going on out there in the community. So the first thing I would explain to families, which most of them already know, is to have their kids eat healthy, which means, eating 3 regular meals a day, not much junk food, stay away from fruit juice, because that's basically toxic to the liver, no soda pop, drink a lot of water, that kind of thing. And make sure your child is doing some activity and not sitting all day at home after school on the computer or watching TV. A kid should do a minimum of a half an hour, even if it's just going out for a walk for half an hour a day, but do something. We have kids who sit around all week and they do nothing. So, eating a healthy diet, being mindful of don't eat junk food, candies, drink juices, be very mindful of what your child's eating, and making sure your child's doing some sort of activity, even if it's a half an hour a day of walking, is helpful. Getting involved in group sports and the like, those kind of things are very helpful. So those are good. The next thing I'd like to emphasize is we have vaccines, just like, the COVID vaccine has been very effective. We have vaccines to prevent liver disease, and the two that are key are hepatitis A vaccine and hepatitis B vaccine. Now, every kid in this province, as part of their routine immunization, can get hepatitis B vaccine in the first 6 months of life. And I would encourage parents to make sure their kids get vaccinated, because you really don't want your child to have hepatitis B. Similarly, for Hep A, when they're older, late adolescence, kids go off to Mexico into maybe not the best environments, and they're at risk for eating contaminated foods and contracting Hep A. So I would advise parents, they don't have to do that immediately when a child is a year old, but certainly their adolescent age children, they should go out and think about getting them Hep A vaccine. So vaccines are a very important way of maintaining liver health. And the last thing, of course, which I think I'm pretty strong about, is no alcohol. I have a zero tolerance for kids to drink alcohol. It's a very big liver toxin, and it's illegal for kids to participate in alcohol until age 18. And I don't think kids should be binge drinking at home or anything. I understand that if they're graduating and you want to have the rare glass of champagne at their prom, okay, but generally speaking, alcohol is a no-no. And similarly, other drugs, of course, have potential risk for liver disease. So healthy eating, exercise, maintaining vaccinations, staying away from toxic agents to the liver, such as alcohol and drugs, I think are the main things to keep your child's liver healthy.
Thank you. And there are a couple of questions from the audience that I'm going to summarize into one. And this is parents wondering what they can do if they have children who have liver disease that eventually become young adults, teenagers. What can they do to A, build resiliency, and 2, to help the children engage in their own care and take care of their livers as they transition into being responsible for themselves?
So I want to emphasize that most kids, particularly those toddlers and young children aged 5 till 12, they're very resilient. They handle things pretty easily, and they're pretty cool with whatever they need to do. Yes, they have to see a doctor, but they're pretty good. It's really the transitioning the care of your child from you as the adult or parent being the caregiver, to the child taking care of his own liver. Now that's a two-way street. It's a difficult process. We actually have in our clinic program dedicated to transitioning kids. The idea is that kids slowly, when they have the wherewithal and the mindfulness and capacity, they begin starting to take care of things like making sure they give their medicines every day, like making sure they're going to their clinician appointments, those kind of things, that they come and they're participating. As kids are getting older, it's important that they begin to assume more and more responsibility for the care. At the same time, and what's very difficult for parents, is they have to step back. Parents have been involved in kids' care for many kids since they were born, for 15 years. And it's very difficult for them to step away, particularly as the child goes to see an adult doctor, where suddenly the parents are cut off, they're not involved. I always tell my patients that when you go see the adult doctor, when your parents call to find out how the appointment went, don't hang up the phone, I have no time to talk to you. They should spend the time, because they too have to understand that their parents are going through this process of allowing the transition. So they have to be a little sensitive, not that they have helicopter parents, but they have to be a little sensitive to go on and understand with what's going on. So for resiliency, I think that comes with time, and it comes with comfort in knowing, 1, that their lives can be normal, and 2, that they're able to manage taking care of themselves. I think that leads to the resiliency and the comfort in order to move them to an adult care situation. And that doesn't happen in a day, but I say from from around the age of 12 till they're 18, there's a lot of time to begin to deal with that. And we do that in our clinic, generally speaking. So it's important for parents to be aware of that, and it is a two-way street.
Well, thank you so much for your very thorough answers. It's been a pleasure. So thank you, Dr. Schreiber.
Well, thank you very much. It's really been great. I really enjoyed those questions. I'm sure families may have other questions. You can certainly steer them into Monica and the Liver Foundation, and I'm always happy to respond to questions. To me, it's more important that you're informed and you have some knowledge about what's going on and what may be bothering you, than leaving yourselves in the dark and being nervous all the time. So please feel free to send in questions, and I'm happy to answer them at any time.
Thank you.
Thank you.
I'm very excited to introduce our next guest of today's session, a daughter and a mother who have embraced the liver journey together. Natalie is 24-year-old and was born with biliary atresia, a childhood liver disease. She had her Casai operation at 9 weeks old and underwent a liver transplant at age 19. The generosity of her organ donor and his family has gifted Natalie with remarkable health ever since. Nickie is the mom of Natalie and Natalie's twin sister, Catherine, who does not have any health issues. The roller coaster of her emotions eventually resulting in acceptance and a determination that Natalie and Catherine would embrace life, built on the mantra of, if she's alive, she will live. Please join me in welcoming Natalie and Nickie Williams.
Hi, everyone, and welcome to the session, Patient Sharing Time. So our two lovely guests today are Ms. Natalie Williams, who is a previous patient of liver disease from a young age, and her mom, Nickie Williams. So thank you so much for joining us and sharing your stories.
You're welcome.
So I'll get right to it. The first question is for you, Natalie. Can you tell us a little bit about your journey with liver disease in terms of what age when you were diagnosed and sort of how that was like growing up in terms of, did you feel different from your peers and how did it affect your life and just day to day?
So I was born with biliary atresia and I was diagnosed around 9 weeks old. And I think for me growing up, I was always aware that, like in my toddler years, you're aware that something was different because I would always ask my parents, like, why was I was in the hospital, why I had scars and other kids didn't. But I think the awareness of what biliary atresia was in terms of its pathophysiology and how serious of an illness it is came when I was maybe 11 or 12. And that was where, like, for me, I really kind of started to struggle as you're trying to process what this illness actually is. And I think we all know, like, deep down that we're not going to live forever. We're all eventually going to die, but it's not something I think the average person is consciously aware of every day. And so for me, like, in learning what my illness was, there was this emotional turmoil of living with mortality. And I was healthy at 11 and 12, yet I knew that there was this potential for this illness to take away not only my health, but maybe my life. So then came this process of trying to live purposefully, despite the fear and the worry that remained. And I think that kind of ties into how I felt different from my peers because, they're worried, especially in high school, about normal high school things. And I didn't relate. And they had a right to worry about those things, right? Like, that's normal. But I was worried about whether I would need a liver transplant, whether I would survive. And so in that sense, I just felt quite different growing up. But yeah.
And how was your experience? So in terms of like going through the healthcare system here, the doctor's appointments, being in the hospital, what was that like for you and the people you met along the way in that road?
I mean, I was so lucky to have the medical teams that I had. I was in such great care. I was with Dr. Schreiber at BC Children's, and now I'm with the Vancouver liver transplant team, and they have just been amazing. And I think it makes such a big difference when you're able to build that connection, that trust, that like rapport with your medical team. I mean, these are the people that really do have your life in their hands, and I felt, and I still feel so lucky that I have just like been so blessed to have these doctors. And certainly post-transplant, there's one person in particular, and that's my transplant nurse, Joanne. And I don't think I could have like kept myself sane really if it wasn't for her just being there emotionally and mentally following that transplant.
So maybe I'm going a little bit off our questions that I was going to ask, but maybe for both of you, Natalie and Nickie, if you had advice to healthcare providers out there, be it nurses, doctors, what would be some advice that you would give in terms of things that really made you feel supported and as a patient?
I mean, I can go first before mom. I think for me, I don't ever want to like really be seen as a patient. I really want them to see me more than the illness. And so it's when you have those like little conversations, like my transplant nurse, Joanne, and I were like looking at shoes on Etsy one day during clinic. And she asks me about road biking, and so does Dr. Yoshida. Like they really have an interest in what you're doing outside of the illness, and it makes you feel seen and heard as just a regular human being. And then because you build that like rapport with them, you're so easily trusting, and it's so easy to then just kind of give your actual physical self over to them.
I would agree with that as well. I think the biggest part of it is the trust. So when Natalie was first diagnosed, it was actually in England, not here. So there's a distinction. When she's 7 years old, we came to Canada. But throughout, what really made the difference was being able to feel secure enough to ask the questions, so that my own understanding of Natalie's illness, once I knew that that was kind of covered off in terms of her physical health was well cared for by the doctors, then all I needed to do was concentrate on her mental health. And so that could only happen if I had a sufficient understanding of what was happening behind the scenes and what the process was going to be at any given time and what to expect. Then once I could manage to balance myself, I can then transmit that to kind of Natalie in terms like, we're okay, we've got this. But absolute, knowing that you're knowing that you're kind of included in that teamwork with the doctors, and so it's hands to the doctors for actually including us in that. Once I knew that, I know when I've got a good team and the doctors are happy to talk to us and explain everything.
Thank you. And Natalie, so you mentioned that at around age 12, when you started understanding your illness, you were quite relatively healthy. What was your experience like when you progressed to liver failure, both physically, mentally, and how was it like coming to terms with the fact that you need a transplant?
I suppose I began to notice the decline in my health around 13, 14 years old. And I think this is where I really started to feel unwell. But with that being said, it's such a gradual decline, and the body is so incredible at just compensating that you just adjust to this new normal. So even with the worsening of symptoms and the development of new symptoms, you would get used to it. And then it wasn't really until the decline sped up in my teen years, and certainly by the age of 18, 19. So at this point, it's 2016. And I spent most of 2016 in and out of the hospital. And then by October, I was listed for a liver transplant. And because we had always maintained hope that I would never need a transplant, yeah, we saw it coming, but it was such a shock. I got off the phone with the transplant team, who called to say that I was now active on that waiting list, and I just cried. I was very scared for the loss of my own life. And I think transplantation isn't something to take lightly. It's such a daunting thing to face as a patient, and it really is a last resort. This was something that we had been trying to avoid my whole life. So to now kind of be in a place where this is the only option, it was just quite inconceivable to be there. And I really struggled with it.
Mhm. And what was the process like from October to the point where you got the transplant, the wait?
I found the waiting for a new liver very hard. And I think it's so almost obvious that it is going to be difficult in terms of you're so sick, you're in the hospital most of the time, and you're really scared for the loss of your own life. But I think for me, like, what was so difficult about waiting for that new transplant is kind of less obvious to the average person. And that is, you know, I'm sitting there and I'm waiting on a waiting list for a new liver, and I'm scared that I will die without one. And so you're very desperate and you're terrified. But that waiting list forces you to recognize that what you're waiting for is a new liver, and that will only come because someone else is going to die. So inadvertently, what you fear most happening to yourself is going to actually happen to somebody else, and their death is going to become so personal because you have the honor of calling them your hero. And so I felt this so deeply on the waiting list, even before I knew whether I was really going to receive a liver or not, and even long before I knew who my donor was. So the liver failure was so hard, the transplantation was hard, but the wait list for me was such a cruel place to be, because it wasn't just the fear of your own life, it was the recognition and the sorrow and the guilt that came with realizing what you feared most happening to yourself was actually going to happen to somebody else and to somebody else's family.
First of all, I'm so sorry you had to go through that. That sounds like a very difficult situation to be, especially at a young age.
Yeah.
What would you say helped you cope and get through it? What were your strongest, resilience points that you can share with others that might be going through the same thing?
I think for me, it would have been so much more difficult if we hadn't had the community that really rallied around us. So this was obviously my family. So my parents, my twin sister, my grandparents, my transplant team were amazing. And then it was also the transplant friends that I made. So one person in particular was my friend Tony, and he and I met on the waiting list for our new livers. So we were both in liver failure, and then we ended up being transplanted 2 weeks apart. And so we recovered together too. And I think given the loneliness that accompanies illness, this was such a huge impact for me, his friendship, because he really understood what it truly is like to go through this. And we went through it together, like side by side. And I often think like what an honor it was to be able to fight for my life alongside someone like him. And so I think my best piece of advice would almost be try and connect with other people who are going through similar. Like you can do that through organizations like the Canadian Liver Foundation. It really makes the aspect of loneliness when you're facing something like this feel a lot less big, and it's comforting to be able to think this person knows exactly what this is like without even having to explain it.
Thank you, Natalie. And now for Nickie,
Mhm.
when did you first realize that Natalie might be sick? And what was the path before you had the diagnosis like for you?
So I guess I first realized that because Natalie's a twin, so I first realized they were both my first babies. I first realized that something wasn't quite right with Natalie. She was vomiting after every feed. She'd got pale stools. She was turning a different, darker color, and she wasn't gaining weight. She was, and so for me, those were the signals, and so then trying to take that to the doctors at my local GP. That was quite a process in terms of getting them to understand that there was something different with her. And so the feedback I was getting at the time was just because the twins don't have to be the same. And so it was quite frustrating trying to say, but look, I think there's something wrong. I mean, I remember distinctly saying, I don't think the dye, whatever that is, and I know is vile, and it's not getting through to her poops. And I even showed them the diaper. And it still took another few weeks beyond that before, when I took it just on a random check on height, weights check, when the doctor turned around and said, how long she'd been like this. And then it was like, wow. Soon as that happened, it was phone calls to hospitals. We were immediately sent to hospital. There was blood work done. And then the next day we found out what was biliary atresia was. So at the time, it was very emotional, a roller coaster in the sense of like, thank goodness this is now recognized, and let's, thinking, and my naivety was, okay, this can be treated and then that's it. And then suddenly finding out that, yeah, this was biliary atresia and this was going to be a lifelong thing. And the end result was likely going to be transplant.
I know that for biliary atresia, usually some of the first steps in management is a procedure called the Casai. I'm not sure if I'm pronouncing it right.
Yeah.
What was your experience like with that procedure?
So we were quickly fast-tracked from the local hospital to the regional hospital, and I met the liver team, what we call the liver team, and there I met a wonderful group of ladies. One was the chief executive officer of the Children's Liver Disease Foundation, and the other one was Dr. Deirdre Kelly, who was the liver specialist in England at the time, which she still is. She's a great lady. And once I'd formed a relationship with those, then I knew I was in a place where I could trust. I was in the best hospital. I was reassured of that. And so the Casai has to be done within 10 weeks. And Natalie at this point was 9.5. And so for best outcome, it's under 10 weeks. So they flew the surgeon home from hospital, they flew him home from his holiday to the hospital so they could actually do Natalie's Casai procedure within that timeline. And yeah, it was quite something. Yeah.
And then jumping forward many years to the time when, Natalie, you were mentioning you were 14, 15, starting to feel unwell and needing a transplant. What was it like for you when you found out that she was going to need that? And how did you cope sort of going through the process and the recovery?
Oh, well, finding out, like Natalie's already mentioned, you know it's coming. You've already been through pre-assessment. Well aware that by then she's in decline because the hospitalizations to manage her pain and her symptoms have already increased. You know which way this is heading, and it's almost like trying to stop that runaway train, and it's not possible. You know it's on the horizon. And even so, when I got the call, I was at work, and I got the call to say that she'd been listed, and I just burst into tears. Because you then realize, on the one hand, it's like somewhat of a relief to think, yeah, this is going to get handled now. And on the other hand, it's like, yeah, the clock has just now been hit. It's like there's a finite time now. You don't get listed unless this is end stage and serious. And so I knew that this is now happening. And we know that some patients die waiting. And so the feelings were one of fear and anxiety, but also mixed with some hope as well. But by far the biggest, if you like, problem was watching Natalie, the raw emotions that she was now going through. It was so much easier when she was a tiny baby, and they were really only my emotions and obviously adults around me, their emotions, grandparents and her dad. But then now I'm taking on Natalie's emotions and trying to navigate that with her. And so it was pretty hard at that time.
It does sound very, very tough, particularly around that end point. And what about growing up? How did that affect the family? And I know that Natalie has a twin. How did that affect having, a child with a chronic illness?
We tried to normalize it as well, as we could. I mean, we basically coined an expression of if she's alive, she'll live. I mean, one of the biggest things I wanted to achieve here was normality. I didn't want her to be the sick kid. I wanted to enjoy her life with her twin for both her sake and her twin's sake. And so for as much as possible, I believe that, we achieved that. And really, we've got some amusing moments out of this. But, for example, Natalie it was interesting to watch them as twins. Catherine was very, very protective when she had an awareness that Natalie got an enlarged spleen and therefore had to be careful climbing trees and rocks. But at the same time, wanting Natalie to do what was normal and also not stunt her growth and confidence and not stunt Catherine's, playmate kind of, and her growth and confidence. And then, there'd be times she was on a liver feed when she was a tiny baby, and so I'd have to creep into the room at night and make sure that she was getting the, you know, the prescribed ounces of this liver feed through the night, which then woke Catherine up. So I then end up feeding Catherine, because my heart would go out. This baby would be looking at me feeding Natalie, and I'm thinking, she doesn't understand that this is Natalie's medication. So then I'd feed Catherine her feed. As Natalie got older and was sitting in high chairs, there was a particular drug that Natalie needed to have. She could just pick it up and eat it, foul tasting as it was. She was okay doing that, but Catherine didn't understand that this was a medication. So I actually had a tube of Smarties in the cupboard, and I used to lick the coating off so that then it looked buffed up the same as Natalie's meds, and plonk that on Catherine's high chair tray, and then stand and make sure neither of them swapped. And so there was little things like that, and, you know, taking Natalie to get her bloods done at the hospital. At one point, the psychologist suggested that we take Catherine with us, because Catherine would struggle at school, and Natalie was being removed out of school knowing that she was going away into hospital. So it was like, take Catherine with you so she can see what happens, and that might reassure her. That went completely wrong when Catherine ended up biting the nurse because she'd hurt her sister, and she was, you know, she was only 4, 5, and so that was when we're like, that didn't work either. So it was learning to navigate that, and, you know, address obviously Catherine's needs and anxieties with having her sister, and trying to have to explain it in their little terms so that they could understand that, you know, and being aware not to tell, if you like, that lies. You know, you can keep saying, oh, sister's going to be okay, Natalie's going to be okay, Natalie's okay, but we don't know when she was not going to be okay. So not over delivering on promises. And so that was, you know, I think that happens to every family, you know, with siblings, twins or not. So, you know, but those were the kind of some of the humorous moments that came out of that.
I'm glad you were able to find some moments very memorable and cute. So maybe moving forward a little bit to the happier times. So Natalie, after the liver transplant, can you tell us a little bit about the recovery and when you started to feel better and sort of recovered from everything that happened?
I mean, I recovered really, really well, like instantly. And I ended up calling my new liver Larry, and Larry and I just got along immediately. And I loved him from the very beginning, and like instantly, even in the ICU, like the jaundice began to fade within a few hours. And I didn't know that, obviously, but that's what my family say. And the ascites was gone within a few days as well. And I really just took that new health and I ran with it. And I was on the road bike and back in the swimming pool within about 2 months. And I went whitewater rafting at 3 months, which the team weren't too thrilled about, but you know, I really recovered in the way that I wish every organ recipient did, because I recovered with such ease and I didn't really know what to expect. So to be able to recover so well, I think it was because Larry was such a perfect match for me, and that made the world of difference. So yeah, it was great.
And did anything change? So it sounds like you were able to do, you know, physical activities in a couple of months. Was there anything that is still different that you have to do on an ongoing basis?
There's the anti-rejection medications, and these medications you have to take on time. And so it's 8 a.m. and 8 p.m. So you're constantly needing to be aware of the time and where you're going. And I think I did take medications my whole life growing up, but they weren't so time sensitive. So that has been quite an interesting process, because also there's such important medications that you always need to be like, okay, well, where am I going and how long am I going to be out for? And you have backups everywhere. So in the car, in my friends' cars, even in my backpack. And when we go travel abroad, you take double the amount of meds. So if we go to Hawaii for 2 weeks, we're taking a month's worth of medications. And then you're getting up at 5 a.m. in the morning to take your medications in Hawaii, because you can't just jump to fit the time change. And so that's, I think, the part that I notice the most. And I think it's such an insignificant part, really. And I think that is just to say the power of transplantation, and that how it really does so drastically improve your life, that really all I have to answer to this question is, well, I have to be aware of the time that I take my meds, which is such a superficial thing, really.
And Nickie, what about for yourself? How are things different now?
I guess the biggest thing right now is I don't have to keep checking my phone. When she was first going through, and before transplant, as she was going into that decline, I was waiting for my, any phone calls that say, "Mom, need to go to hospital." At work, watching my phone for the same thing. Certainly going through the transplant, once we're listed, he was waiting for that call to say they'd got the liver. So for me now, it took a while to get out of the habits, and it's still somewhat there, at times. But yeah, I've learned now that I actually don't need to keep that phone constantly by my side. I don't need to keep checking it. She's okay. And for that, obviously, we're eternally grateful every day. We're so thankful for the donor and the donor family for giving us that gift. That's, the peace of mind comes from being on the, out the other side of that. So that's the biggest thing. And watching the joy, watching her live and knowing that they can both go hiking. I mean, they put the fear of death in me at times when they decide to go skydiving and things. But I mean, there's a joy to seeing that. And I mean, I knew instantly as soon as we went into the ICU, I could see the change in her color instantly. It was obvious that I knew then. I thought, this has worked. She's doing good. She's going to be fine.
Amazing. Natalie, can you tell us as much as you're comfortable sharing about what is going on in your life now? What kind of activities are you doing? What are your interests? Do you have any goals for the future, maybe with your career? Just to share how your life has really changed after, the transplant and after recovery.
So I'm in my 3rd year of nursing school right now, and I will graduate in April of 2023. So I'm really interested in pursuing a career in the ICU and in transplantation. And I feel like with a lifelong career that I'll have, I'll probably end up doing both. And then being as it's winter right now, me and my sister are spending most of our time skiing in our spare time. And then in the summer, we love hiking. And so we go out into the backcountry and we'll just go for days and we'll just hike. And we have so many epic hiking trips planned for this summer that we're really looking forward to. And then I like swimming, road biking, hanging out with my friends, and just really just living, just truly immersing myself into life, and to just love and give to others unconditionally too, because I've received so much that I really feel like I need to give back. And I am big into crossing things off my bucket list and really just making my donor proud as much as I can, and living for both myself, but also in his honor. That is so important to me. So that's kind of what I'm up to these days, just going on tons of adventures, and then obviously studying all the time.
Yeah, with nursing. Well, that's amazing. I think you're going to make an incredible nurse, and having that lived experience and going through the ups and downs of illness and the transplant process. It really, I'm hearing your story. It's hard. It's really, really hard, but you made it, and you shared some amazing advice that I think our viewers, especially those that might be going through the process themselves, can benefit from.
Thank you. I appreciate it.
Thank you so much, both of you, for sharing. It's been an absolute pleasure. Now please stay tuned for Dr. Scudamore's liver health tip of the day. And Dr. Scudamore was actually, as Natalie mentioned, her transplant surgeon.
Yeah.
Small world.
It is.
Hello, I'm Dr. Charles Scudamore. The final tip of the week is hepatitis. Hepatitis is one of the many diseases that affect your liver. You may not know you've had hepatitis. Hepatitis can be silent. It can be something that mimics some other disease process. If you or your doctor or a family member comes down with liver disease, pay attention. You may want to be screened for underlying liver disease that may have been missed or you didn't recognize.